Hi, today we are going to see Nurse's Notes. Nurse's Note is a factual record containing the information about what nurses see, hear, feel and smell about a patient through their direct observation and their patient care. This nurse's notes acts as a legal document. So care should be taken when you are writing or charting nurse's notes, even if you are a registered nurse or a student nurse. So through this video we are going to see some of the points you need to keep in mind and also how to write a nurse's note. Since there are chances we make errors, there should be some points you should keep in mind. Do not erase or apply correction fluid or scratch out errors made while recording. And if you make an error also, draw a single line through the error. You have to write the word error above it, and after that you have to sign your name or initials and date it. You give a single strike, then you write the correct word, put your sign with your name and initials and date. Do not enter personal opinions. You should never write the patient seems anxious or the patient appears to be agitated. You have to enter only objective and factual observation of the patient's behavior through the vital signs or any other measurements. And also you need to quote all patient comments if it is important. Avoid rushing to complete the charting. Be sure that information is accurate and complete. You should write legibly. It should be complete. A person reading the documentation should be able to determine that the patient had received adequate care. Later on, when the file is taken by any legal representative, they should be able to understand what was written. Do not leave blank space in nurse's note. You have to write continuously line by line. If space is left, you have to draw one horizontal line and you have to put your signature and name. If you feel like some orders which the doctor has given is prescient, record that clarification was sought. So you should never record physician made error. Instead of that you chart Dr. Smith was called to clarify the order for analgesic. Then you put the date and time of the phone call along with the person with whom you spoke, whether it is Dr. Smith or his assistants, and the outcome of the call should be mentioned. The telephonic recording also should be mentioned in the nurse's chart. Next, never chart for someone else. Maybe the other person is busy. You should never feel like you can chart for them. It is wrong. Never chart before doing the things. You may be going to give a bed bath. You feel like after the bed bath it will take time. So you will chart it beforehand. It should never be done. Only the actions that have been done should be documented. Do not wait until the end of the shift to record important changes that occurred several hours earlier. Be sure to sign each entry. After each important event that has happened to the patient, you have to chart it. Otherwise, you will forget at the end of the shift. Begin each entry with the date and time and end with your signature and title. If it is computer documentation along with all these things, you have to keep one thing in mind. Keep your password to yourself. Don't share. Correct spelling demonstrate a level of competency and attention to detail. So Whatever you are writing should be correct. There are certain things we should not write and what you should write. Things like patient drank an adequate amount of fluid. So here it is not clear how much amount the patient drank. So you have to write intake 250 ml of water. And never write large wound healing well. It's not clear. Instead you need to write wound 5 centimeter in length without redness, drainage or edema. And don't write patient seems anxious. You can write how you understood the patient is anxious. The patient's pulse rate is elevated at 110 beats per minute. Patient reports restlessness. We are going to see a sample nurse's note now. So this is a sample nurse's note. First you will be putting the date, then time and what is to be documented. So the nurse took the charge at 8 a.m. So we will be writing received the patient from Mary RN. The patient is alert, oriented to person, place and things, skin warm and dry, no sign of cyanosis or pallor, no acute distress noted, on room air. So whatever was observed for the patient at the time of receiving, the nurse will be writing. Even you can write a 22 gauge cannula was present on the left arm and IV fluid normal saline was going at the rate of 26 drops per minute. So like that you can write, then you put your name, signature and your initials. RN, registered nurse. If you are a student nurse, you have to write SN. So here you can see there was not enough space, so one line is kept horizontally and you will be writing it. Then next patient is met at 8:10 a.m. So at that time what action was done is vital signs was checked and it was found within normal range. So here the vital signs are not explained in detail. Temperature, pulse, respiration, everything is not described here because there is already another chart in patient's file which shows vital signs. 9 a.m. administered prescribed medications. So there is another medication chart which shows what are the medications to be given. So we will be writing administered prescribed medications, put a line, write your name, initials and signature. Then after the medication is given, the nurse will be assessing whether the medication was tolerated or not. So 9:15 a.m. again the nurse is writing patient tolerated medications well, no adverse reactions observed. Later on the nurse was in some other duties, went to the patient at 10:30 a.m. for morning routine care, assisted with morning hygiene and grooming. 11 a.m. encouraged to ambulate in the ward for 10 minutes. Patient ambulated without difficulty. Steady gait observed. So here the nurse has written very clearly how much time the ambulation was done and also how the patient responded to the ambulation and how it was. It is very clearly written. Then 12 p.m. patient reports headache and pain score is 7 by 10 reported to Dr. Smith. Then 12:10 p.m. vital signs checked, seen by Dr. Smith, prescribed medication. So 12:15 medication administered. 1 p.m. patient reports headache is improved. The pain score is 0 by 10. 1:10 p.m. consumed lunch, rice, dal and fruits. Drank 600 ml of water from 8 a.m. till now. Then 1:45 p.m. health education on hypertension given. Patient verbalized understanding and asked relevant questions. And last at 2 p.m. when the handover is given, we will be writing handover given to staff Roy RN. Then you put your signature, name and your initial. So this is a sample nurse's note. Hope you will be writing a nurse's note in this way. Thank you.